Hello, everyone. Welcome to, this is Flip Chips. Welcome to the GERD series, and this is episode 3. And today we will be focusing on, the different symptoms or the general symptoms of GERD. And, before we proceed further, just a few cautionary statements. I am not a physician, nor am I a health professional. The information, views, and opinions I am making are based on, my experiences with a GERD and with my interactions with doctors, health professionals, and other persons in relation to this topic. I strongly advise that you consult with your physician first before you go into any treatment regimen or lifestyle changes, so that they may help you, and guide you accordingly. Okay, so let's begin. One of the things that is, really characteristic of GERD is the symptoms. Is the symptom? Yeah. Um, One of the there are lots of symptoms when it comes to GERD. There are a lot of signs that your acid reflux is getting out of hand. Now, most of them, share the same characteristics with, acid reflux because, well, as with the previous episodes, we have said that GERD is chronic acid reflux, and the most severe, I think, symptom is heartburn. It's when it's just really painful at the center of your chest. It's sometimes unbearable. It's it really feels like you're having a heart attack. Although that's what most of us, God forbid, haven't had heart attacks, but GERD patients usually feel like it is a heart attack, but it's not. Our hearts are mostly healthy. It's because it's near to the heart. It's right here at the center, where the pain is most concentrated, and because that's due to that one. It is because of the acid creeping up the esophagus, and it's like injuring or scraping your esophagus, which is not supposed to to endure that kind of punishment, the strong acid coming from your stomach. So yeah, and really severe heartburn cases, uh, mostly you cannot move because of the pain, and you may be given antacids, pain relievers, but pain relievers, most of them at least, or a lot of them, cause heartburn or acid reflux too. So that will depend on your doctor, the risk. Now, the heartburn patients do, have a tendency to go to the emergency room because of the symptoms. And of course, that's actually better. I would advise to personally, if you are not sure if you have chest pains, and you're sweaty, you're nauseous, you're feeling dizzy, lightheaded, or you're palpitating, by all means, go to the doctor or go to the emergency room to have yourself checked. Okay. Okay. So, and most of these symptoms, by the way, happens when you're lying down, because um, when you're standing up, gravity is your ally. The acids, gravity pulls acids down to your stomach, unlike when you're sleeping. And even though if you're laying flat on your bed, uh, the acid could go up your esophagus and sometimes even in your throat, or it, sometimes it may even reach your mouth. But that's really the worst case. And of course, if you have a meal, a heavy meal, uh, the stomach produces a lot of acid, and that results usually in heartburn as well, or hyperacidity. So it is also suggested that you sleep with an elevated upper body. So that's it. So that gravity will help you alleviate will help alleviate acid reflux. So that's the chest pain part. And there are other symptoms, not really minor, some, let's say, co-symptoms together with heartburn. And of course, number one would be stomach pain. If you have lots of acid, sometimes the lining in your stomach, it's much like gastroenteritis or ulcer because of the acid is penetrating the lining of your stomach. That's good. And you know it's really painful at times, the pain in the chest plus the pain in your stomach. So you have to really watch out with especially your diet. We're going to go into that later in a much later video, so we're going to concentrate on the symptoms today. And okay, so let me see, your stomach will produce more acid, you should still have yourself checked. Endoscopy should be fine. Okay, so let's move on to the next symptom, and that is tension headache. Yes, this is usually a tension headache. Goes hand in hand with anxiety or worrying that something really serious might be happening deep inside you. Especially if you are not sure if it is GERD related or if it's something else. Still, if it's too much worrying or anxiety, it's like a rubber band crushing your head. That's one of the symptoms, especially if it's the first time. That's what happened to me the first time. I thought it was something heart related, but I do get myself checked from time to time. And especially, of course, if you don't understand the condition yet. Okay, so see, that headache may reduce your ability to think properly, and your concentration may be compromised. So that's it. As always, if you have some symptom, do not treat the symptom. Treat the underlying problem or the root cause of the symptom. Okay, which is like smoke. You can blow away the smoke, but if the fire is still raging, or still it's going to produce smoke again and again until you put out the fire. Okay, so that's tension headache. And there's also a headache with nausea, which is also common. Nausea when you feel, fainting or something. It's felt during acid reflux as well, and it happens especially if your GERD is already there for a long time. The shooting pains, because of the gas, sometimes from your stomach, and then it rides up to your shoulders. That's one of the symptoms as well. It's painful, yeah, but sometimes you have to squint. You squint, right? You squint because it's too painful. And we feel it all around our stomach as well. Sometimes you feel bloated. It's another one. Okay, and one other symptom is anxiety again. As with all the other symptoms that we discussed a while ago, a person may be anxious as to what he or she is feeling, especially if he or she hasn't experienced that sensation yet. If it's the first time, or if the person does not understand the condition yet, that's fine. And all the other symptoms will just come in: tension headache, difficulty breathing, hyperventilating. And speaking of hyperventilating and difficulty in breathing, when your GERD is serious enough that acid contents or stomach contents, including acid, goes up to your esophagus and goes into your lungs, it may irritate the upper respiratory tract. And so again, I'm not a doctor. It's just I have talked to quite a lot of them already about GERD, and I'm just sharing this information to you and hope that I could help you guys. Okay, so again, difficulty breathing. Sometimes you may misinterpret it as asthma or upper respiratory tract infection, which is quite common if acid contents go into your lungs. And uh, one severe symptom is severe cough that may lead to pneumonia. It happened to me, I think, once. It went in my lung and it was difficult. So it may lead you to faint sometimes, tension headache. But if you do not understand what you're feeling, especially if it's pain that the pain that you don't understand, please by all means go and have yourself checked. You owe it to yourself to to take care of your body. And okay, so well, those are the basic symptoms of GERD: bloating, passing gas quite a lot. That's normal. And another symptom is sometimes maybe IBS or irritable bowel syndrome. You sometimes you feel that you want to pass too, but sometimes you don't. But when you do, it doesn't happen. If you don't, then it happens. So yeah, it's confusing. So better have yourself checked. And there are well, before we end, again, let's focus on the chest pain because that's where the pain is, where it is most concentrated. So there are subtle differences between heartburn and heart disease, but again, rather than trying to diagnose yourself, search through the internet and try to, hey, I have this symptom, I have this and this and this combination, it's heart disease. So don't think of it that way. I mean, have yourself checked as soon as possible. Medical tests and with the guidance of your doctor, that's the best thing that you could do. And I mean, don't wait for it. It's better to be sure than sorry. Okay, so well, those are I think the basic symptoms of GERD, the general symptoms at least. That's what I have encountered as well. I mean, some combinations, sometimes just one of them, and yeah, that's okay. I mean, all right. So I hope I have helped you understand or identify symptoms of GERD if you have chronic acid reflux. And again, please have yourself checked if you feel anything funny or if you feel something, you feel any pain somewhere in your body. Have it checked, just to be sure. Okay, so I'm just happy to share with you all the information that I have. I have acquired over I think it's more than 2 years now since I've had GERD, and it's on and off. But well, I have improved quite a lot lately, and it's due to diet. We're going to go into that. We're going to have a specific topic so that you don't get overwhelmed with all the topics if we put it all in one basket. Okay, so again, thank you very much for watching. Thank you for your support, and I wish you all well. And don't forget to click on subscribe, turn on notifications. I will try to release a video once a week. I have a busy work schedule, but I will make time. I really want to share this information to all you guys. And if there are any corrections or anything you want to add, or please feel free to put in the comments section. Okay, so again, have a nice day, guys. Take care.